So, Katharina, how are you today? My name is May. I'm your physical therapist. I know you have a little problem with your knee. I'm going to take a look at it, alrighty, which requires me to put my hands on you. Is that okay? All right, I'm going to just, palpate it and just take some measurements. Okay. All right, so we're going to start with her right knee. Some people, it really is up to them. Some of them like to have a little towel under their knee because it just cuts off the edges of the table. You know, it's not necessary. But if they feel more comfortable with it, okay. You want it? Okay. Is that okay? That's fine. All right. So, all right, remember with palpation, you always want to start with the joint line in the knee, okay? Because that's the most biggest thing, and that will sort of lead you up to everything. All right, so I'm going to find a joint line. If a person who has a very swollen, arthritic, or some kind of soft tissue injury knee, can't always define it that well. Here you could really define it, right? Mm-hmm. You can see where it is, right? You can't ask them to just move a little bit, and then you'll be able to find it. Right, bring it back down, relax. Okay, so I'm gonna go from the joint line. I'm gonna start anteriorly, just below the joint line. What should I find? What's these things here? Tibial plateaus, okay? Alrighty, had tibial plateaus. Okay, what you want to call them is lateral or medial. Okay, don't call them right and left, gets really confusing sometimes. Mm-hmm. Alright, so I'm on the right tibial right tibial, medial plateau right here, right lateral tibial plateau. Bring your legs, you okay? Yeah, okay. Bring your thumbs together. What should I find?
Tibial tuberosity.
Tibial, okay, before I get to what's the soft tissue, right?
Patella
tendon.
Patella tendon.
Patella tendon. Alright, so you want to make sure you're on patella tendon. People who have a lot of soft tissue injury, again, you can't show because it's swelling, everything's all mushed together. Just bring it up. And you should feel a little tautness as she brings it up, okay? So bring it back down. So right under her tibial plateau should be the beginning of a tibial tuberosity, right? And they may feel a little tenderness, okay? Because again, what is it? It's bone. All right, so they don't stay on it too long. All right, so moving back up. All right, I'm back up on her tibial, patella tendon, going towards her patella right here. All righty, and you could actually take your thumb and your index finger and just sort of put on the medial and lateral sides of it. Alrighty, moving up. Alrighty, you'll be at the base of her patella, and for approximately like 3 fingers width, that should be her quad tendon. Alright, can you kick up? Alright, you kick up, you'll feel a little tightness there coming into play. That's the quad tendon. Going all the way up will be her quadriceps muscle. Right, blending in together to come to the quad tendon. Over the patella to the patella tendon. Okay? Did I skip anything? Tibial crest. Oh, tibial crest. Alrighty, going back to the tibial crest. Alright, from the tibial tuberosity, here she is, straight down. Okay? That's that nice cresty, sharp area. A lot of people, I shouldn't say a lot, some people have a defined tibial crest. Right? It's just a nice ridge. It's just a nice ridge. Right? So going back up, right? Now going back up and going back onto the medial tibial plateau. Right here. On the medial side, we'll have what area? Those 3 tendons coming together to form the goose feet, goose neck, whatever you call it. Pes anterine, okay? Now, what muscles make it up again? Gracilis.
Semitendinosus.
And? Semitendinosus. Those are the 3 ones. Now, it's kind of hard, unless you're contracting all the muscles, it's kind of difficult to see exactly the definition muscle, because that's that soft tissue coming in together again, right? Right before it, you have the tendons of all the muscles. As it gets more rounding anteriorly, you'll get the pes anserine area. Right under that whole pes anserine area, between the tendons and the bone is what?
Bursa.
It's a bursa. We have the pes anserine bursa. Remember, bursas, you cannot really palpate definitively unless there's something wrong with it. Then when there's a bursitis, it's inflamed, it's a little tender, and then you know what, then it'll be much more easily palpable, right? Okay, now to look for the tendons, okay, of the semitendinosus, membranosus, and the biceps femoris, they're all back here somewhere, right?
Mm-hmm.
You may be able to feel the differentiation. I mean, I could on her right now. I definitely feel the biceps femoris tendon on the lateral side, alrighty, without making her contract a little bit, right here. Oh, okay, I feel two stringy little things here, alrighty. I can't really differentiate 100% totally, so what I'm gonna ask her to do, alright, is basically do a contraction against me, okay? So can you just scoot forward a drop, alright? Alright, now just sort of push against my hand here. Oh, this way, push back. Go, 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 go. Alright, as she's pushing back, okay, there you go. I feel one a little bit more medial. That will be the tendinosus, semitendinosus tendon. Right? The one that's more laterally, laterally now at this point, that would be the membranosus tendon. Right? Because both of them are coming straight down on the medial side.
Mm-hmm.
Yes or no?
Yeah.
Right? The membranosus tendon is going to be a little bit thicker. A little bit thicker. Good. Tendon, fibula head. Alrighty, so, alright, fibula head, if you remember on your skeletons, it's right below your lateral tibial plateau and a little bit posteriorly. So if you're gonna go back to your joint line, go to tibial plateau, move your fingers towards the posterior aspect. I'll show you over here since you're videotaping. Okay. Right. Here's the posterior aspect of her tibial plateau. You go just drop one finger's width, depending on your size of your finger. You should feel a bump. Alrighty. Now, it should be the fibula head. To make sure, can you just sort of like rotate your leg back and forth, like in and out? Try the whole foot. Try the whole, like the whole leg itself. There you go. All right. Now, if you feel something rotating under your fingertip, that is going to be your fibula head. All right? Show you guys on this side. Okay, just one second. Right there. That should be a fibula head rotating away. All right? So that's a fibula head. And you could possibly follow it all the way down if you palpate slowly and deeply in, right to her lateral malleolus. All right. Oh, so with the fibula head now, what's that distal attachment? What's attaching distally to the fibula head? Okay. Well, yeah, your ITB is actually attaching more towards the tibia, right, into the lateral retinaculum area. There's one thing that's definitely attaching there. Fibularis? Okay, not the muscles. Lateral collateral. Your lateral collateral ligament. So, to find your lateral collateral ligament, find your fibula head, because that's going to be bigger. Bigger landmark. Right? So here she is again. Alrighty. Now, meet the proximal landmark would be what? What's this thing over here called again?
Tibial plateau.
Well,
Or wait.
the thing up here. Up here.
Oh, lateral.
Lateral condyle. Yeah, lateral epicondyle. Alrighty, so can you just rest your leg over here, man? Okay, so find both ends of the landmark. Alright. Yeah, rotate your foot again. Thank you. Alrighty. I'm just gonna put my finger smack dab in the middle. Alrighty, it should be, again, like I said, depending on the size of your finger, one to 2 finger widths in between. Alrighty, and I just want you to slowly flex and extend. Okay. As she, excuse me, as she's extending, you will feel a taut band right underneath where your fingertips, and it should be right in the joint line, right? And that will be, as she's flexing more, right? You'll feel be a little bit less taut. As she's starting to extend, you'll feel that tautness again, and that's her lateral collateral ligament. Ooh, very good. Now she's in full extension right now, and I really feel it. All right, that's her lateral collateral ligament. Show it over here too. Okay, so I found her fibular head. Here's her condyles. I'm gonna go down to the epicondyle. Remember, the epicondyles are those, just the pointy end of it, and here it is. Okay, so she's flexed right now. I'm just gonna arbitrarily put my fingers right there. All right? I don't feel much besides soft tissue. All right, so, sorry guys. I'm gonna extend her up, right? And you should feel a little tautness coming in. All right? Bring her up. And there she goes. All right, and you could slowly feel it coming into play. Yes or no? Mm-hmm. Okay? Now, medial collateral ligament's a bit harder to find. Why? What's there?
Oh, the Pezanserine.
Pezanserine. There's a lot of crap there. There's a lot of stuff there. It's a bit harder to find most of the time because there's just more stuff. So you got to be more distinctive of it. All right. So what you want to do, it is at the posterior aspect of the tibial plateau, medial tibial plateau, medial epicondyle now. Get a spot, joint line somewhere. I'm trying to push the stuff out. I might take up some slack. It is difficult to find sometimes. All right. I think I got it right here. Alrighty, right, the medial condyle. Because remember, what's it holding to? What two bones is it holding together? You put it down.
Femur and the tibia.
Yeah, the fibula and the tibia on the medial aspect. So since there's more soft tissue on this side, right, it is a little bit more difficult to find.
You said the fibula and tibia?
Oh, did I say? Oh, tibia,
Yeah.
tibia and
Femur.
femur. Tibia and femur. Okay. Mm-hmm. Are we good? All right, and the last thing is the iliotibial band. Now, what is it again? What muscle does it connect from? TFL, okay? So, if you remember from anatomy, it's just basically a long band of connective tissue, right? Mm-hmm. Alrighty, and it melds in right in this area, right? So to find the band itself, right, you want to be more above the joint line, right? Couple inches or something like that, and you're gonna ask them to do what, you think, in this position, to sort of make it pop out into your fingers. What does ITB get to do again? Okay. ITB, it plays a role. Well, actually, it plays a role more in the extension, but it plays a role. Its primary function, ITB, is what? Hip what? Abduction in a flex position, right? So if you ask her to sort of abduct in this position, right, you will be able to sort of feel, palpate that ITB band, right? Because if you're just looking for, not technically the tensor fasciae lata at this point, because it's nowhere near there. All you have is the ITB at that point, all right? The tensor fasciae lata muscle is actually quite small. Most of it is just connective tissue. Right, so we're gonna find her fibular head again to give me a good start. Joint line. Alrighty. I'm gonna be more near the posterior aspect. I'll go over to that side too. Alrighty. Now, alright, can you just sort of push into my hand that way, okay? Alright, you're gonna just move your leg out to the side. Go, 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 go. Alrighty. And what's she doing? She's doing more external rotation. I'm gonna just extend her a little bit so I don't get that in the way. Alrighty, now push one more time, go, 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 and you will feel the ITB coming out, alright? Right? The reason I extended her because she started to externally rotate too much for me. So I extended her knee out a little bit, so I can just get to the ITB a little bit better and get rid of some of the other muscles. Show you in this way. Fibula head. All right, find everything. All right, and again, I'm approximating where it should be. All right, put your hip leg on knee rest. All right, push out, go, and you can see. Oh, try not to lean too over too much. Go ahead, go, 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 and you can feel that tautness coming into play right here, and that will be her ITB. Yes or no?
Mm-hmm.
All right, and remember the ITB comes around and sits right onto the lateral aspect of the tibia, right into the lateral maculum. Questions? Okay. Hey, so, goniometry. This is easy. Two things it only does, not like the hip. Alrighty, so, can I measure her in this position for knee extension?
No, because her hips.
Yes, because the hip is, coming into play, because you're gonna get the active and insufficiency coming into play. Now, in the clinic, do you see people, can you see people measuring them in this way?
Yeah.
Yeah, absolutely. All right. What's the bad thing? Okay, besides the insufficiency stuff, what's the other bad thing about measuring in this position?
The table.
Table.
Table's in the way.
Table's in the way for flexion, and what else?
Uncomfortable.
Uh,
Therapies and-
No. Yeah, slightly uncomfortable. We get used to it, unfortunately, as therapists. Right? What if she doesn't have enough quad strength?
Mm-hmm.
All right?
It's against gravity.
It's against gravity, okay? So we're not really sure. It is against gravity, so we're not sure. Alrighty? Does she not have full terminal, say she comes all the way up, like say right here? Is it because of lack of strength? Or is there because some scarring or soft tissue injury in the way? Right? We're not really sure. So that's why we usually like to measure them in a supine position, just for range of motion, right? Yes. If I measure here for full extension, and she goes all the way up, am I gonna be concerned that I measured it in the wrong position, you think?
No.
No, because she has full extension, I'm not gonna worry that much. But if I ask her to kick up and she goes right to here, that's gonna say, oh, she's lacking definitely 30-something odd degrees, right? So you wanna be aware of if she's lacking range of motion, right? Is she really lacking range of motion? Because say if your patient came to see you in an outpatient clinic and she walked in relatively well, right? Oh, okay, if she walked in relatively well, why can't she, make her leg straight now? Right? So you sort of need to sort of think about that when you're measuring, okay?
Mm-hmm.
Right? Typically, I like to measure in supine more for the fact it's easy to get somebody supine, right? Prone is okay too, alrighty, but people don't like laying on their stomach. Most people don't. It's just too much for them. Okay, so do you care which side?
No,
Okay. You want a pillow?
probably not. I'll just take this.
You sure?
Yeah.
Okay. Alright, so. So, when you're measuring knee flexion or knee extension, you want to use the lateral epicondyle as the fulcrum because your epicondyle, it's part of a bone, it's not going to move anywhere, all right? The joint axis will sort of start moving all over the place as you start bending or extending your leg, right? Proximal arm, you're going to use the shaft of the femur using the greater troch as your distal landmark. Moving arm or distal arm, you're gonna use the fibula and use the lateral malleoli, okay? You do want their toes pointing up, okay, as best as possible, all right? Can you bend this leg for me for a second? Just bend. Okay, put it back down. Okay, good. Alrighty, so I got it right here. Line everything up. Rotate a little bit. Okay. Right there. So for her, okay, she is actually starting at 0. Okay, so so she's definitely at 0. So before we bring her up, can you just bring it all the way up, like slide your heel on the bed for me? Okay. Keep going. Go, 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 go. As much as you can. Alrighty. Alright, slide it back down. Now, if she's uncomfortable or she's complaining, straining in the back, alright, while you're doing this, you can bend this other knee just to sort of give her slight posterior pelvic so she can stabilize herself. Alrighty, if it's not bothering her, then leave it be. Alright, so I'm gonna line her up again, so I have a general idea of what she's got. Alright. Okay. Alright, pull it away a little bit so I don't interfere. Actually, she's at a little bit -1 right now. So I'll take -1, right? So can you slide your leg up for me, okay? Right, on the count of 3. 1, 2, 3. Go, go, go. Follow her along. All right, go as far as you can. That's it?
Yeah.
Okay. Line everything up. Okay. So she went from -1 to 141. Okay, so what is her range of motion? The total range itself? 140. 140. Okay, why did she go to -1, by the way?
Hyperextended.
She hyperextended herself, and what else took over? Gravity. Gravity took over. She's been laying for a while. Okay, so you know, I mean, -1 to, it's 1 degree. It's probably not a huge difference. If I was looking like, say, 6 or 7 degrees, I'd probably, be concerned about it, or at least take note of it. Yeah.
That's what, if has excessive hyperextension, would you still keep her in supine?
If she was in excessive hyperextension, it really depends on how much excessive you're looking at. Because if she's laying down on a table, you may not notice that excessive hyperextension. So you're talking about like what, 15 degrees or so? You may not notice it at this point because she's being stabilized here and here by the plinth.
Right.
All right. So at that point, if I really wanted to look at it, I would probably, if she's that excessive, I would do her in standing.
Right.
Measure it very quickly in standing.
Okay.
Okay. No, it's a good question, right? Because it would be gone because the table is just stabilizing her now. All right. So if I wanted to measure, so this went from extension to flexion. So if I want to do flexion to extension, where would I start?
Inflection.
Flexion. Yeah, kind of makes sense, right? Usually when you're doing knee flexion extension this way, it's one quick shot. It's one quick shot we do it. Okay? So she's starting out this way. I'm estimating, again, hopefully 140 when I stick a goniometer. Still the same landmarks. All right? Okay. Alright, yeah, she's still there, and I'm gonna ask you, can you slowly slide your leg down? On the count of 3, 1, 2, 3. Okay, go. Okay. Alright, she's still 1 degree of hyperextension. Alright, so she went from 141 flexion to -1. Alright, so it would be read as 141 to 0 to 1. Okay? Because she went into hyperextension. Now, what if she, say, went from 141 to, say, here? And I'm going to say it's, real quickly, 20 degrees. How would you write that?
141.
141 to 20, okay? So that's gonna indicate she ended at 20 degrees of still flexion, okay? Does that make sense over there? Okay, good? Alrighty. So, okay, manual muscle testing. Oh. Passive range of motion. I'll do this one. You guys can see. Alrighty. So again, passive range of motion. You want some good control. Alrighty, so I like to do the heel, so I can prevent, control the foot a little bit. And I like to do just right around the knee area. Alrighty, I'm gonna slowly bring it up. Try to relax. Okay? And when you're testing end field, you may wanna, like I said, bring them up a couple of times before you test the end field, so they get used to you. Alrighty, as you get to the end, you give them a soft little push. Right? And what should it be?
Soft.
Okay? Bring it back down. Alrighty, and what should it be?
Firm.
Yeah, it should be a firm. Now, if she was stuck at 20, like this, what might it be? If she's stuck at 20.
Hard. Hard.
It can be hard, or it can be firm. It really depends. Is she stuck because there's a bony thing that's making her stuck, like the arthritic changes? Or is it because she has tightness? So you really need, it can be either or, right? Because that's, that comes with a pathology. What's making her tight? Is it more muscular, or is it more osteo stuff going on? Does that make sense? Yeah. All right? Okay, questions on that? Okay, and then manual muscle testing, you're good? Hold on. Alrighty, so you're in supine, let's do, since you're, okay. Can you go pro? You want a pillow?
No.
You sure? Okay. Alrighty, so can you scooch down a little bit so your feet hang off? Okay, oh, quick thing before I forget. Depending on the person you're gonna measure, okay? You may want them as close to the edge as possible so your goniometer does not get in the way, alright? Because sometimes if say she has a really small knee, alright, and I'm using this one, alright? This thing can get in the way, alright? The bottom half of the goniometer. So you may want to bring them off to the side a little bit. Alright, so for knee flexion, alrighty? You definitely want to give them a towel roll or a pad under the knee that you're testing, alrighty? Because you're gonna ask them to resist against you, and when that happens, they're gonna end up pushing their kneecap right into the bed. And depending on your plinth, it's gonna hurt a little bit. Alright, so lift up. Alright, knee, lift up your knee. Okay? Good?
Yes.
Alrighty, so can I see you bring your left leg, your left foot towards your backside for me, please? Good. Oh, try not to rotate. Do your best you can, okay? Alright, you guys see that? She rolled right over. Try not to do this. Bring it back down. Okay. Alrighty, so she has good range, okay, with knee flexion, right, in against gravity position. So I'm gonna wanna just see can you just do it one more time for me? Better. Okay? Still a little rolling, but not as bad. Bring it down. Right? So she's rolling now. Okay? I'm gonna wanna stabilize where? So to prevent her from rolling so much. Lumbar spine. I'm gonna put my hand right here. Alright? Yeah, right here. I'm gonna go this way. Alrighty? Now, since I'm going against gravity, alright, alright, I'm gonna put my resistance in the middle somewhere. Okay? So on the count of 3, I want you to bring your foot to your backside again, and I'm just gonna resist you a little bit, okay? Whatever resistance I feel, I'm gonna give it right back to you, okay? On the count of 3, 1, 2, 3, go, 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 and relax. Now, she did have a little weakness, so I would say she's, 3+ or so out of 5. Right? So I want to distinguish exactly which muscles are a little bit weaker. So I'm gonna change my hand position a little bit. So I'm gonna go this way, and you're not coming a little bit closer to me. I'm gonna be this way, so I can sort of resist her and sort of feel for the muscles too. This is, yeah, right? And can you do me a favor? Put your hand here and hold on to the table, okay? Hold on to the table. Don't roll to the other side, okay? Because I want to feel for the muscles. So I'm gonna rely her holding on to the table to prevent her from rolling, okay? Alrighty, don't fall, okay? Alrighty, so on the count of 3, alrighty, I want you to bring it up for me, okay? 1, 2, 3, go, 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 go. Good, better. Actually, much better. She was actually stronger this time around. She self-stabilized her a little bit better instead of me stabilizing her. Alright, so that's good. Plus, you guys were looking at her.
Wouldn't that give her better leverage?
Yeah, gave her a little bit of leverage, alrighty? So it helped her, but she needed that stabilization. Yeah. She was like, I'm gonna be strong, I don't care. She told me I'm a 3. Alright? Okay. Alright, so now if you want to distinguish more, if it's biceps femoris that's a little bit stronger, or your semi-muscles are a little bit stronger, what you can do is rotate the lower half of her leg. So can you sort of turn your left leg outwards, like point your toes that way towards them, okay? Alrighty, that also gives her a little tilt already to the other, rotate to the other side. But keep doing that, rotate your leg. Now, can you sort of bring it up a little bit? Now, flex your leg up like you did before, okay? Now, go, 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 go. That will make her biceps femoris come out a little bit more easily. If you guys, relax a second. If you want to see, take a look. Alrighty? Alright? Now, you can focus on this area where the tendons are. You won't be able to notice it here that much. Alrighty? On the count of 3, bring it up. 1, go, 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 go. You can see her biceps femoris coming up more. Relax. Can you do it again? One more time the other way. Turn your foot medially. Alrighty? On the count of 3, 1, 2, 3, go, 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 go. Ooh. And there you can see right there, her biceps, her semitendinosus and membranosus coming in more. And relax. So if you really want to distinguish which one is stronger, alrighty? But if you are distinguishing which one is stronger and you're resisting them a lot, what's gonna happen?
They're gonna.
You're gonna what? They're gonna be tired, okay? They're gonna be tired, but before they get tired, they're gonna call in every piece of their hamstring muscle they have. Alright? So this honestly is only useful when you know you have significant weakness in the hamstrings. And you have significant weakness.
In this case, which one is stronger, which one's weaker?
Say again?
In this case, which one is stronger, which one's weaker?
For her, her biceps femoris was a little bit stronger. I felt it. Okay? I felt it. I had to do a lot more.
It's the biggest, right?
Biceps femoris,
Of the
muscular-wise, yes. Muscular-wise, yes.
And you have the 2
Yeah.
that.
Alright, so if I was gonna do gravity eliminated now, what position would I have her in?
5.
Sideline? Is that what you guys are gonna say?
Yeah.
Yeah, okay, sideline. I would have a sideline. Okay, so can you go sideline? Can you want a pillow?
Yeah.
Okay, scooch towards me, a drop. Okay, alrighty. Alrighty. Again, you want to make sure her trunk, pelvis, leg are all nicely aligned with each other. Put your hand here so you can support yourself, okay? Alrighty. And what you're gonna do here, alrighty, I'm supporting it, drop it in my hand, okay? Alrighty. So what I want you to do, I'm just gonna support it, but I still want you to bring your leg towards your backside. Okay, hold on for a second. Relax. Let me get this chair out of the way.
You have enough room?
Yeah, now I do. Alright, so on the count of 3, just bend your knee and bring your foot towards your backside, okay? 1, 2, 3. Good. And I'm just gonna get out of her way. Alright, now if I wanna palpate her muscles, I'm gonna put my hand here. Alright, I'm gonna change my spot a little bit. On the count of 3, bring your foot towards your backside a little bit. 1, 2, 3. And I feel her hamstrings coming into play. Yes or no? And at this position, I'm still at a good position to tell her to help stabilize herself. Alrighty? Tell her how to correct it a little bit as she's going through this test. Right? So what else is this position for? Again, gravity eliminating.
Hip extension.
Hip extension, okay? Alrighty? Hip extension, hip flexion,
flexion.
hip flexion, knee flexion, knee extension. So if I'm testing for a knee extension, now what position would I be in? Same thing. I would probably, I would still be in back. I'd probably still be in back of her, okay?
Yeah.
Because I don't want to get in her way. So she would bend your knee, okay? Bend it, alrighty? And I would change my hand position this way. Alright, drop it in my hand. Go ahead. Alright, so she's flexed to approximately 100 or so. Alrighty, so what I want you to do now, alright, and bring your leg back a little bit. Alright, I want you to extend your leg on the count of 3. 1, 2, 3, and we'll just go with her. Okay? And bring it back. Do it one more time. Drop it in my hand. Try as best as you can. Alright? And bring it forward. Kick out your leg, nice and slow. Good. And bring it back. And again, you're supporting it, you're not helping it. There can be difficult every once in a while. Am I helping her doing this by supporting her? Alrighty? Or am I just supporting her? So you just want to make sure you feel that leg heavy in your hand, because if the leg is heavy in your hand, you know you're not going to be able to really make her do that movement. She's going to have to do it on her own, right? And you're just going to go along for the ride. Yes or no?
Mm-hmm.
Okay. Can you come sit up for me? Last one.
Are you palpating with
My right hand.
supporting?
I'm palpating a little bit. I could only get sort of the medial aspect. The rest of it was here.
Okay.
Okay? The rest was this hand. And I'm using my elbow as a support mechanism. Okay? Come into short sit. Don't push my this here. That's all everybody can see. Alright, and the last one. Knee extension. Alright. Alright. You want a towel under your leg? Or no, under your knee? You fine? Okay. Alright, so knee extension now. Alrighty. Against gravity. So can I see you? Hold just, yeah. Perfect position. She's a good patient. She knows what to do already. Alrighty. Can you bring your leg up for me? Oh, we're doing this leg, okay. No, that's okay. Bring it up. Good. And bring it back down. Okay, so I know she has good range of motion. She brought it up against gravity. It was nice and controlled. Alrighty, so what I want you to do now, I want you to do the same thing, but now I'm gonna resist you a little bit, okay? Now, her stabilization should be enough, but I'm gonna keep an eye on her, and I'm also gonna have my hand right here to palpate for the muscles, alright? And I'm gonna see exactly, what she's gonna do. So on the count of 3, apply your resistance distal to the joint. So I'm gonna be mid-calf somewhere, okay? On the count of 3, bring it up. 1, 2, 3, go, 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 and relax. Good, all right, and she was very good. So she's definitely a 3+ out of 5. Good? It's
It's like when
okay.
dude, you get a 4.
You really want a 4, I know. That's good. That's good. Alrighty. So that is against gravity. Question. Okay? Questions? Are we good? Alright, so practice the knee and the hip, then come at 1 o'clock or so. I'll start the ankle. Okay?